The FL9000 respiratory humidifier is supplied with the following: an operating manual, a dual heated wire adapter lead, and a humidifier temperature probe lead. Before the first clinical use of the FL9000, it should be tested by the hospital EBME or bioengineering department to ensure that the default parameters match the departmental patient care protocols. The FL9000 can deliver humidified gas using either heated wire or standard non-heated wire circuits and single or dual limb breathing systems. Mount the FL9000, ensuring it is secure and the heater plate is level. It must be positioned lower than the level of the patient's head. The use of breathing circuits, humidification chambers, and other accessories which are not approved by Flexicare may result in suboptimal performance and place the patient at risk. The humidification chamber is fitted to the heater plate by applying downward pressure on the spring-loaded front guard, sliding the chamber into position and then releasing the guard to lock the chamber in place. Unravel the delivery set and attach to the sterile water bag or bottle using the vented spike. The pinch clamp should be closed. Remove the protective cover from the humidification chamber and discard. Attach the blue ventilator limb to one chamber port and to the ventilator. Connect the inspiratory limb to the other port of the chamber. Please note that either chamber port can be used as the inspiratory or ventilator connection. Connect the heater wire lead to the DIN socket on the right side of the FL9000. If using a dual heated wire adapter lead, as in this case, the shorter of the two leads is inserted into the cloverleaf connection on the elbow of the inspiratory limb. The longer lead is connected to the elbow at the ventilator end of the expiratory limb if a dual heated wire limb is being used. The temperature probe lead is then inserted into the jack socket on the side of the FL9000. The two different types of socket prevent attempted misconnection and potential costly damage to the heated wire and temperature probe leads. The central temperature probe is then inserted into the sensor port on the elbow of the inspiratory limb. The probe at the end of the lead is inserted into the sensor port at the patient end of the inspiratory limb. Please note that the probes must be firmly seated to avoid leaks and ensure the tip is correctly positioned in the center of the limb to provide accurate and reliable readings. Once functional testing is completed, open the pinch clamp and allow the sterile water to flow into the humidification chamber. The Flexicare autofill chamber also has a unique secondary valve system, which acts as a safety feature to prevent overfilling of the chamber should the primary valve fail. The secondary valve will shut off the water flow when the level reaches the maximum as marked with a double line on the side of the chamber. Connect the patient end of the breathing circuit to the patient airway or delivery device and then turn on the ventilator. Only when the chamber contains water and the gas is flowing through the breathing system should the FL9000 be turned on and warming and the humidification of the respiratory gases begin. Please note, should the gas flow stop or become interrupted, the FL9000 respiratory humidifier should be immediately turned off and not restarted until the gas flow is restored.